Hi, everyone. My name is Shay Smith, and I am one of the PAs at your TSIG Wellness Center. I'm here on this Wellness Wednesday to talk to you a little bit about one of the most common cancers that we see in men, and that cancer is bladder cancer. Now, bladder cancer is actually about 3 times as prevalent in men as it is in women. So it's really important that you know the signs and symptoms and get a little bit of a background so that you can protect yourself. So just a little bit of anatomy. Our bladder sits just south of our kidneys. Our kidneys are in this picture kind of higher up from the bladder near the rib cage on each side of the spine. Our kidney's main function is to filter out our blood. And as it filters our blood, it removes all the toxins and harmful elements, and it sends that down our ureter, so that tube that's draining the kidneys, into our urinary bladder. And that's where it sits until you're able to relieve yourself. And the reason that that's important is that bladder cancer typically starts in the inner lining of the bladder. And that's because those toxins are sitting there, and that's the area that's most exposed. So bladder cancer starts in the cells that make up the urinary bladder. And then if it's not caught early enough, unfortunately, oftentimes it'll then form a tumor, and with time it can spread to other parts of the body. So who's at risk? As I mentioned, men are 3 times more likely than women to develop bladder cancer. However, when women do develop bladder cancer, it's usually more aggressive. Now, how I mentioned that the kidneys filter out toxins and chemicals that are harmful to the body, and how it sits in that bladder, and that's where the exposure happens and creates that cancer risk. That is how being a smoker or having chemical exposure puts you at a higher risk, because your body's had to filter out those toxins and your bladder's then been exposed. Also, men over the age of 55, 9 times out of 10, when somebody presents with bladder cancer, they're over the age of 55. So if you're a man, if you've been a smoker, if you've worked with any harsh chemicals, especially manufactured dyes or textiles and paint products, and you're over 55 and you think you might be at risk, come in and see us. Now, one of the main symptoms is blood in your urine. Blood in the urine can appear either bright red or like a light tinge of pink. And then sometimes it can even appear as dark, like a Coca-Cola colored. Now, bladder cancer almost always presents with blood in the urine, but blood in the urine can also indicate a lot of other things. The key thing to take away from this is that if you're having any of these symptoms, come in and let us know, or let your primary care know, so that we can take a look into this further and get things worked up for you. So with that being said, if you have any concerns, any questions, make an appointment, give us a call, and we'll help you out. I hope you have a good day, and if you have any questions, send them our way.